So my name's Dr. Olivia O'Donoghue. I'm currently a GP living and working in Darwin. I'm also the Medical Director for the Flinders Regional Training Hub here, based in Darwin in the top end. The Flinders Regional Training Hub looks at improving access to medical career pathways for medical students and junior doctors in the NT so that we can increase our capacity and sustainability of workforce for the Northern Territory. I'm also a medical educator and give medical education support to the Indigenous General Practice Network. And I also happen to work for the college who's presenting with us tonight. So I'm very proud to be facilitating this event for our Northern Territory Medical Careers Pathway webinars. This has been a collaboration over 2020 and into 2021 with the Flinders Regional Training Hub, our specialty colleges, and some of our well-respected and valued NT clinicians. So this is the first webinar for 2020. And as I said, we're starting off with one of my favourite colleges. I might be a little biased as this was the college that happened to give me a fellowship way back in 2012. So I'll be introducing to you some members of the Royal Australian College of General Practitioners, the RACGP, and who I said I currently work for. So I'm also an employee as the censor for the National Faculty of Aboriginal and Torres Strait Islander Health for the RACGP, among all the other hats that I wear, that is. So today the RACGP is going to share with us the career opportunities and training that they offer in general practice, including rural generalist training opportunities. And we'll hear from the rural faculty members from the RACGP, but we'll also be hearing from two NT-based GPs, a current RACGP trainee and also a new fellow of the RACGP who happens to be a born and bred Territorian and did her GP training in the NT as well. So before going any further, I would like to officially acknowledge the country from which we are bringing this webinar to you this evening. So I'd like to pay my respect to elders past, present and emerging of the traditional owners and custodians of the nations from which we are zooming in from. In particular, I'd like to pay respects to the RACGP people, whose country I'm zooming from, and where one of our presenters is Dr. Simone Liddy as well. I'd also like to pay respects to the people of the Tiwi Islands and their elders past, present and emerging, where another of our presenters is zooming from, Dr. Siobhan Hensey, and the people of the Meru Nations of the Western Riverland region, where Ken is joining us from as well. So before much ado, I'd like to hand over to Dr. Ken Waiguru, who is the censor for the Faculty of Rural Health for the RACGP, who's located in Waikerie in South Australia. And without much further ado, because I'm sure Ken will tell us a bit more about him, I'm going to stop sharing my screen and I'm going to hand over to Ken to tell us all about all the exciting opportunities there are for training and working in general practice. And I'm sure he'll tell us all about rural generalist training as well. Thanks, Ken.
Thank you very much, Olivia. Can you see my screen?
Yes, we can.
Good, thank you. I don't like assuming. So as you heard, my name's Ken and I'm the RACGP Rural Censor in South Australia. I work as a general practitioner, rural generalist, a procedural GP. I do anesthetics, obstetrics, emergency. I also have a real interest in palliative care. So a real mix, a real rural general practitioner, I would say. A bit about the RACGP. We are a big organization. We are the biggest professional medical college in Australia. For about 80% of rural GPs are represented by the RACGP. We train for every postcode in Australia, and every RACGP fellow is rural ready. People always wonder to what level do we train, and it is to competence to deliver unsupervised general practice services in any general practice setting in all of Australia. So that really defines who we are and where we would like to train you to. The pathways that you can get to fellowship are basically the RVTS, which is a remote vocational training scheme, which would not have much relevance for you guys, and PEP, which is a practice experience pathway, and this is for the older GPs who have extensive experience in general practice. What you would be interested in is the Australia General Practice Program, and that is it's a program that takes registrars and who are pursuing training in general practice in Australia, and it will now be delivered by the two colleges of general practice, which are the RACGP and ACRAM. I'm obviously going to talk about the AGPT pathway for the purposes of this presentation. And the training organization in the Northern Territory is the Northern Territory General Practice Education, so NGTPA. So that is that's the organization that delivers it. I must declare I have a great bias. My real interest is in rural general practice, not just general. So rural and remote general practice is what my heart's in. And although we're talking about general practice in general, I do always like putting in a quick promotion for rural general practice. So what are the good things? Really, we've got flexibility of the work that you can do and the hours that you can do. It's general. You can just choose to do a bit of everything or pick your niche. What you really enjoy. The cradle to grave medicine is excellent. You work in a great team. It's the training is relatively short and a real advantage. It's cheap. If you look at the other specialties, you'll understand that this is really quite affordable as well. Traffic in rural areas is so much better than out in the city. I really do enjoy that bit, and you're part of a community, and there's nothing better than actually seeing your the baby that you resuscitated 5 or 6 years down the street, or even better, 12 years, 18, 20 years later, having another baby, having their own baby. So it is quite exciting. If you're in the Riverland, where I am, obviously you've got sport, the river, food, wine. So lots of good things about general practice. I guess one of the things, some of the things that people say are not, can be a bit of a challenge is that you work in a bit of a fishbowl where everyone in the community looks at you and you fit in, and that can be a bit of a challenge for some of us. There are reduced opportunities for spouses, and there can be social and professional isolation. But remember, a lot of us have been there before. When to apply is a question that everyone asks, and I remember that you've got to do your internship. You're all familiar with what internship is. It's a 1 year of rotation, which will probably be changing in the not too distant future. But that just gives you, when you work under supervision, you want to pick up skills and make sure you're safe before you're fully released on the unsuspecting public. So I don't think I need to say much more about internship. You can apply for your postgraduate later on during your internship, or straight after your internship for your GP training, and that would be through the AGPT, as we said, and the applications generally will open in March. If you're thinking about general practice, please try and remember that relevant, there are important rotations that you should try and get in your internship. And that's a bit of medicine, a bit of surgery, pediatrics, and emergency. So if you're thinking that this is where I want to go, try and organize your rotations to fit in, to make your life better, because that will make your life a lot better. the process really is you are going to sit an exam, which really is, has it's called the CAT, the Candidate Assessment and Applied Knowledge Test, which has a bit of knowledge and situational awareness questions, really fairly straightforward. And then that gives you eligibility, and your interviews you will be assessed by the NTGPE. It's pretty straightforward in that way. So what's the training for the fellowship of the RACGP? We generally, I would say, 3 pathways in currently, which will probably shrink to 2. The standard FRACGP, which already gives you training to be able to practice general practice anywhere in Australia. It's 3 years, hospital training for 12 months, GP placement 18 months, and then extended skills for 6 months. And we've already talked about the mandatory hospital rotations. The FRACGP plus RACGP, you get an extra year to acquire an advanced rural skill. And remember, the RG is very similar to the FRACGP plus RACGP. So the current AGPT rural RG program, which is what we have started offering, and we are going to transition gently from FRACGP, RACGP to RG. That's already happening. Gives you extra advantage in that you have more training time, you're allowed to transfer. But I think one of the things we are especially proud of in the RACGP is that we offer lots of flexibility. So we don't think that there's only one way, that there's only one sort of doctor that will solve the problems of Australia. So you've got flexibility, and if you do change your mind, you can move. The RACGP, and this is, you've got to bear in mind that there was an agreement about RG. The colleges came together, and there was a National Rural Commissioner, and came up with what's called the Colin Grove Agreement. And you need to do, rural generalism is a specialty within general practice. And you need to do some time in rural general practice. You need to acquire an extra skill, and our emphasis is with your community. That's why we want you to experience a rural community or a remote community and see what skills do they need. What can I do that will help me look at help my community? So rather than it being just about us, it's also about our community, and that's a good thing. And you have 12 months to acquire an advanced rural skill. And we agree that emergency medicine is compulsory. So there's at least a 6 months emergency medicine module. The advanced skills could be in procedural, that's anesthetics, obstetrics and emergency, or non-procedural, Aboriginal and Torres Strait Islander health, adult internal medicine, mental health, palliative care, and so on and so forth. And there is that flexibility that allows us to come up with with slightly different advanced skills as well. So we're currently working on moving the FRACGP and RACGP into the RG, and we obviously working on this. We're not waiting for recognition, because that is something that the college is working on as well with ACRAM to get us recognized, to get RG recognized by APRA and the medical board. So that is happening as we speak. But as soon as that's approved, the RG will be ready, and the states have coordination units already that are setting this up. I'm not going to talk much about how the training is delivered in the Northern Territory, because there are my colleagues who will be telling us a bit more about that. So not too worried. I think I'll leave that to those who have actually experienced it. As I said, the huge advantages with the RACGP are the flexibility. We are not too worried about the order that you do it in. We're not worried about where you do it, transferring. We want you to have the context. So we emphasize trying as much as you can to do it within the context. So we want you in a rural or remote setting for your training, and we have that support. obviously, if we are a big college, so you have a better chance of getting support and mentoring. And I think that's as fast as I can talk to fit in all that. There's a lot of information, and I could talk about this, as you can tell, for the rest of the week, but I've got to stop.
Thank you very much, Ken. There's certainly a lot of information about the college, the rural faculty and training. From an NT perspective, I guess we're all a bit biased towards rural and remote practice, given that everywhere outside of Darwin is considered rural and remote even. If you're looking outside Alice Springs by the standards of the rest of the country and classifications of rurality. And Darwin's probably even considered quite a rural town based on some of the standards of the other states and territories, maybe. So I think we're all a bit biased in terms of being a bit passionate about rural health in the NT. We might save some questions for later, particularly about training. So I'm going to move forward and introduce our next speaker, who is Dr. Simone Liddy. Simone is a new fellow for the RACGP and also happens to be one of our Aboriginal and Torres Strait Islander doctors, which we're very proud of in the NT, and one of only, or including myself, of about 80 Aboriginal and Torres Strait Islander GPs across the whole country. So a very minority group. Simone is a GP now working at Generalism Health Service in Darwin. She's going to tell us all about her training journey, but something she might not tell us, which I'm going to disclose, is Simone was the NT state recipient of the Young Australian of the Year award for outstanding achievement in academics and sporting, and she had a past career in pharmacy before embarking on her medical career. She's also an avid sportswoman and has represented the NT, I believe, in hockey, so she might tell us all about her other extracurricular passions that she has keeping her anchored to the Northern Territory. Thanks, Simone.
Thanks, Olivia. So I'd like to begin first by acknowledging the traditional owners of the land that I'm zooming from, the Larrakia people, and pay my respects to elders past and present, and also extend that respect to Aboriginal and Torres Strait Islander people here today as well. So I'm Simone. Olivia's already I'm given such a lovely introduction. So I fellowed with RACGP last year, and I'm an Aboriginal woman and a local raised here in Darwin, currently working at Generalism Health Service, which is an Aboriginal medical service here in Darwin. So today I've been asked to talk to you a bit about my journey into GP training and to become a GP fellow. I thought I'd start by first talking about why I chose GP. So as Olivia alluded to, I got out of school and first studied pharmacy and really loved the science and medical side of things. It was actually during my pharmacy degree that I asked to go and do a work placement at an Aboriginal health service, Lisa Durba, actually, where I'm working now. And it's there where I started to feel passionate and inspired with Aboriginal health. The reason I actually even chose Lisa Durba was because it was actually the local clinic that I attended already. So I loved my placement there, and that's what gave me the inspiration to pursue further studies in medicine. While I was in medicine, I did tell myself to keep an open mind and see if there was any other specialties that I would be interested in. And GP just happened to be the one that I kept on coming back to. During my medicine degree, I loved I loved all my GP placements. I even chose to come back because I was actually studying in at University of Queensland interstate. I even chose to come back to Darwin to complete a elective placement at Lisa Durba again, and that just continued to confirm my passion for GP in general, and for Aboriginal health in the Territory and my local home. So for me, it was going into it, I was always still quite passionate about GP land. Some of the things that drew me to GP compared to other specialties was that I loved that it's general, that you get to see all different aspects of medicine, whether it's, you know, seeing obstetrics or, you know, pediatric medicine or surgery or medicine. I just got to see a broad range. So I didn't feel like I had to choose one area in particular of medicine. And I also loved the flexibility of general practice as well. Being able to, you know, be able to do my own hobbies and sport and still and be able to work or have the option of dictating hours and working part-time was a real bonus for me as well. The other thing too was that I loved my home, Darwin, and I'm very passionate about Aboriginal health. So I had a great opportunity to be able to work in my hometown in an area that I'm passionate about as well. So while I was training, what I made sure that I did was to give myself a broad range of experiences. I was really, and that's one thing that's, I think, a great advantage in working in the Territory and training in the Territory. So I was able to work in rural, in Jabiru, as well as flying in and flying out to certain remote communities. I also worked in a private practice as well and got some experience there. And of course, I ended up back at the place I love, which is Lisa Durba. I find working as a GP very rewarding, challenging, definitely. Because we do have to know, I do feel like we have to have a great knowledge about all different areas. But I am continually learning from my colleagues and from my patients. And the one aspect of GP that I love most, I'd have to say, is when you get clients that come back to you, clients that come back and see you time in and time out, and you get to know them really well, the regulars, and you get to, they then, you know, it's really rewarding to then have them bring their family to come and see you, or if they're pregnant, to be able to see their children and then continue, you know, that continuity of care is something that really drew me to GP training as well, and has kept me passionate and loving this area. I was also really fortunate while I was training to have a great opportunity to work in a non-clinical role as well. And that's where I was able to meet one of our other panel members, Dr. Siobhan Hensey. We worked as a registrar liaison officer for our training provider, NTGPE. Just one day a week. It gave me a non-clinical day, and it also gave me the opportunity to be able to get experience and knowledge in areas other than GP clinical work. So I was able to learn more about policies and the training and support and advocate for my fellow registrars as well. So, you know, within GP training, there's also other opportunities that are non-clinical as well, which are, you know, can be really great opportunities too. The other thing that I'd just like to mention for other Indigenous GP registrars or students that are looking into training with GP is I was really fortunate that we've got lots of other support that is available to us as well. There's through RACGP, but also one that was a really great support for me was the Indigenous GP Registrar Network, or IGPRN. We meet twice a year and do complete some workshops, some exam workshops. And that's there where I was able to network and meet other registrars, and we all provided support for each other while we're going through the exams. And also some really great mentors as well. One who's here tonight, Dr. Olivia Donoghue, and another I'll mention is Dr. Simone Ray, who were just such an inspiration to me, and such great support as well. So, you know, make sure if you're Aboriginal or Torres Strait Islander, make sure that you do look into these other supports as well, because I found them to be really, really valuable. And then I think if I was to give advice to anyone considering GP training, especially in the Territory, I would say, you know, while you're a med student, take any opportunities you have to complete any experience in GP, to meet and network with GPs, and especially, you know, we're really lucky to be in the Territory. Take those opportunities to get some remote experience, and even, you know, experience in Aboriginal health as well, because it's really valuable and rewarding. So thank you.
Great, thank you, Simone. It's a little dog bark applause in the background there too.
Sorry.
I will pay you later for the lovely comments you made. No, I was in terms of additional support that the RACGP gives to Aboriginal and Torres Strait Islander registrars, there's a lot of pastoral care and support that happens from the Aboriginal and Torres Strait Islander Health Faculty, as well as some additional examination preparation courses that are available to everybody, but are available to our Aboriginal and Torres Strait Islander trainees in a smaller cohort with other Aboriginal and Torres Strait Islander trainees from across the country as well. And that program is called Yagila Wadamba. So thank you very much for letting us know about your journey and your passion and commitment to general practice. It's really lovely and rewarding to hear from our new fellows, and also to hear about the other opportunities that are available to trainees and new fellows in their general practice journey as well. Thank you very much, Simone. I'm now going to hand over to Siobhan Hensey, who is a current trainee in the Northern Territory, originally from Victoria, but training with Northern Territory General Practice training here in the NT on the RACGP pathway. And she's currently living and working on the Tiwi Islands, which I'm sure she will tell us all about. So thank you, Siobhan. I believe you've got a presentation to share.
I do. Thank you, Olivia. I'll just share my screen. How's that?
Yeah, we can just see your presenter slides, not the slideshow. So you might want to...
How's that?
That's perfect.
Okay,
great.
Excellent. So hello everyone. As I've been introduced, my name's Siobhan. I'm a current RACGP trainee with NTGPE. And as Simone mentioned, I also am currently working in the Registrar Liaison Officer role with NTGPE. Before I begin, I would like to acknowledge the Tiwi people, the traditional owners of the land that I'm speaking on today, and pay respect to their elders past, present and emerging, and also pay respect to any Aboriginal and Torres Strait Islander people listening in to this webinar. So who am I? as I said, I'm a registrar. I'm a postgraduate medical graduate. So I had a previous life similar to Simone, except that I was working as a personal trainer prior to entering into medicine. I'm originally from Victoria. I moved to Sydney for my medical training, and now I'm in the NT. I moved to Darwin at the start of 2019 to begin my GP training after 2 junior doctor years in a busy Sydney hospital network. I've got a lot of work experience in various areas, so I moved around before settling on health, particularly after working in the fitness industry. I really wanted to get into health, both in more detail and from a broader perspective, because I feel like particularly in general practice, you have so many opportunities to help people improve their health in so many different ways. My educational background includes a Bachelor of Arts, Bachelor of Science, and so I did some English and some immunology pathology. And as I said before, I'm currently completing my GP training after my 2 junior doctor years. At the moment, I'm living in Wurrumbiyanga, which is one of the bigger communities on Bathurst Island, the smaller of the 2 Tiwi Islands. It's a short ferry ride or a short plane ride north of Darwin. Although Melville Island, the other large Tiwi island, is actually quite big and is second only to Tasmania as an accessory island of Australia. So there's a pretty big amount of land out here, beautiful, beautiful land. That photo is me walking my Tiwi dog, Roo, along past the water. And that's just one of the reasons that I chose to come and live and work in the NT, and in particular in remote NT, because this sort of lifestyle and experience is honestly second to none. The lands that you work on are stunning. The communities are phenomenal and will teach you so many things about life and culture and community that really, really enriches you both as a person and as a GP. So first of all, I'll just explain where each of my photos is from. This is one of the first photos I took in remote Northern Territory. As a medical student, I was lucky enough to go with the John Flynn Placement Program out to Nangmarianga, otherwise known as Palumpa, which is in the Northern Territory, southwest of Darwin. So a completely different direction to where I am now. And that building in the centre there is the clinic. So that's where I worked as a medical student. I did 3 different placements there over my 4 years, and those sunsets are stunning, but not uncommon. It was an amazing place to work. So as I said, I moved to Darwin a couple of years ago, specifically for my GP training, because I really wanted to get that broad exposure to rural GP, to remote GP, to tropical medicine. There's an incredible amount of tropical medicine that you can see throughout the Northern Territory. And I also really wanted to do some Aboriginal health. I think the added depth in community health in an Aboriginal community or within Darwin itself makes the whole experience of working in GP that much more enriching. And I know that I personally really enjoy working in remote Aboriginal health for all of the things that I learn, and just for the lifestyle out in community. I have actually also worked in Lisa Durba, where Simone currently works. And so that was a very interesting perspective of working in an inner city urban clinic, and also working with Aboriginal community members who I knew from remote communities. So why did I choose the NT? Why didn't I just stay in Sydney? As I said before, I think it's really exciting medicine. I think in the NT you get some really complex medicine, like I said before, with tropical disease, but also unfortunately due to the heavy burden of comorbidities in our remote communities with our Aboriginal and Torres Strait Islander community members, it does mean that as a GP you are sometimes managing some really complex medicine. I knew that I wanted to do medicine that was broader, or rather potentially what some people might describe as more specialised than an urban GP practice. But I knew that I didn't want to work in a hospital, and I found that working in remote health or rural health has really given me that opportunity to do some general practice and get that continuity of care, but also deal with some complex medicine, either in a team with doctors from hospitals or managing complex things out in community, similar to what Ken was describing before, looking at obstetrics. Not so much looking at anaesthetics, but also managing some internal medicine, which is really, really interesting. The climate. Look, I'm not going to lie, the build-up in the wet season can get pretty intense and pretty hot, but the dry season up here is absolutely amazing. And even throughout the wet season with the storms and the rain, it really is an incredible place to live. And the people and the culture, things I've mentioned before, just add that extra depth of experience living in a community in the Northern Territory, whether that be Darwin or a remote community. There's definitely a community feel wherever you go. So what are some of the challenges? One of them that you might be able to imagine is there can be a limitation in the resources that you have on hand. For me, that's something I enjoy. If you're a creative thinker, if you like to think outside the square, if you are innovative in how you solve problems, then that's a really great strength for you to have when you're going out to work remote or rural. If you're not necessarily like that as a thinker immediately, that's okay, because you're often working in a team and everyone else can play a role, and finding out just how you can manage things on your own without a CT scanner in the room next door can really hone your medical skills and can be really rewarding. It can be overwhelming with its complexity. As I mentioned before, there's a high burden of chronic disease, and the complexity of the medicine that you can be managing can be overwhelming. But a benefit of being in GP is that you do most often get the opportunity to see someone again. You get that continuity of care and you get to work with someone in finding different ways that you can tweak their healthcare to help people make some changes and to really make some long-term changes as you go along. It can sometimes feel like you're only scratching the surface, and that's because you are. Particularly in remote communities, the depth of the social determinants of health plays such a huge role, and you can't fix those all in a day. But as I said before, week by week, little change by little change, you can still make a big difference, even though you're not resolving all of those problems at once. And all it takes is a day working as a GP to find out that those little things that you can help people decide to do can make really big changes. Even if they might have been small in your day, they can really benefit someone in a big way. Limited health literacy and limited time to overcome this. One of the common things that I experienced and that I've spoken to a lot of people about is time pressure. I don't think I've ever met a doctor who hasn't experienced time pressure, whether it be on ward rounds or the 4-hour rule in ED or GP running 15, 20 minutes behind seeing your patients. And that time pressure seems to so often be there. And it can be really hard to pick what you're going to dedicate that time to. And if you have to take that extra time to explain where you're coming from, to ensure that people understand where you're coming from, then that can feel really difficult to manage. But it is so important, and it's something that if you invest in early on, it can pay dividends later on. So limited health literacy really has just made me think outside the square and how I explain things to patients, whether it be in the middle of urban Darwin or in remote NT, helping someone understand a diagnosis or why they're taking a medication or the reasons for referrals for particular investigations is so important, and is actually something that I really enjoy about working in general practice. So what are the advantages? Like I said before, learning about culture and community. I really, really appreciate being in the middle of it all in remote NT and even in Darwin, learning about Australians, First Nations culture and the nature of an Aboriginal community. Working with incredible colleagues with vast experience, as you've seen, even just in this webinar, you can work with some really incredible people with some amazing experience and a lot of skill in heaps of areas, not just in medicine. And I think you gain a lot from the relationships that you develop, particularly in the NT, where it is a smaller pool, it is a smaller network. And I encourage you to make the most of those networks, ask questions, get to know people. Particularly in the NT, I found that everyone is really, really friendly and so willing to answer questions. So if you want to reach out and talk to someone, definitely do, don't think twice. As I've discussed before, opportunities to work in areas of medicine and do things that you don't see in other parts of Australia. Your capacity to make a significant difference helping someone improve their health. As I've discussed before, I think GP is severely underrated in just how much of an impact we can make in primary health care to the global health and national health of Australians. I think that the primary health care, how people view GPs, really underestimates the impact that you can have, and I encourage you to embrace that if that's what you want to do. Living and working in amazing locations. I've discussed that enough. Need I say more? This is the incredible ceiling of one of the art centres out here in Wollongong. It's I'm ashamed to say I can't pronounce the local name, but it's called Keeping Place, and it's out of the centre of town, but it's well worth the walk because the painting that they do out there and the carving, the silk painting that you can see on the bottom is just incredible. If you get a chance to come out and visit the Tiwi Islands, either on a tourist ferry or for the Tiwi Footy Grand Final in March, I really encourage you to go out and see this place because it's beautiful. So what are my longer term goals and what can you do with GP training in the NT, particularly RACGP training? Continue working with Aboriginal communities. In the NT, you have an opportunity to work in remote communities, but also visit other communities. And I'd really like to continue working with Aboriginal and Torres Strait Islander people and working out in other remote communities. There's also an opportunity to work for what's called the RMP on-call service, which is an on-call doctor based in Darwin or in a city centre on a phone line, and they receive calls from a lot of the remote area nurses around the state or the territory. And that's a really interesting role to play because a lot of the clinics in remote communities are run solely by remote area nurses who have additional training on top of their nursing training to be able to manage emergencies. And you are then the doctor that can be the contact to arrange transport into town or further emergency management if needed. So that's another option that you can look at the completion of your GP training, which gives you just a little bit of a different experience while still working in general practice. I'm considering further training in different specialty areas such as palliative care or public health. And I know plenty of people that do this, that might do a couple of clinical days, that might do some extra specialty training and might work in different areas with their GP training. So people often talk about general practice as being training that you can do for a breadth of medicine. And that's true, but it also is changeable. So your GP training can allow you to then to progress to work in different areas and different specialty areas under your FRACGP. Part-time work options. I do not believe anyone that says that they definitely want to work 5 or 6 days a week all the time. I think you can love your work, but I think working part-time and being able to fulfill other areas of your life is excellent, and I am embracing that wholeheartedly. And continue with community engagement outside of work. That's something that I personally really enjoy doing and would really like to get back to, and I think that that is just such a benefit of living and working in a community, whether it be a rural, remote or urban centre community. So this is one of the roads out past the airport in Wollongong, and there are some great mountain biking tracks and rough roads out there to gorgeous swimming holes and beaches. So that's a picture of my bike. Who are your key contacts? Obviously the RACGP. There are a number of people you can contact there. And in particular, the GP in training faculty have a Facebook page and they can answer lots of your questions. NTGPE, the Northern Territory General Practice Education, the training organisation that runs the GP training in the NT. And obviously, as I mentioned, I'm one of those contacts. I'm also happy for you to contact me just as a registrar, not particularly through NTGPE in the Registrar Liaison Officer role. I'm happy for you to email me. My email address is there, and to answer any questions via email, or also arrange a time when we can have a phone call or a Zoom just to answer some questions that you might have. So thank you for having me.
Thank you very much, Siobhan. I'll just get you to stop sharing your slides for us. Thank you for sharing your story and telling us all about your journey into general practice. And of particular note for those students and potential medical students who are watching, Siobhan mentioned the John Flynn Scholarship Scheme, which is a really good opportunity for any students who are interested in doing placements in primary care in rural and remote areas, and in particular in Aboriginal and Torres Strait Islander health. And there's plenty of opportunities for those placements to take place in the Northern Territory. And obviously that seeded a passion for Siobhan to come back as well, and could do for any future students and current medical students as well. And I really love that you presented a whole heap of challenges that you've had, Siobhan, working in general practice, and particularly in remote general practice. But each of those challenges you presented as an opportunity to embrace and learn more and explore yourself and invest in your own personal growth as a doctor. And I wish you all the best in the rest of your training and through to fellowship. We had a question posted online, which, Ken, I see you have answered privately to the person who posted it, but I wonder if you might like to answer that question live. So the question was, why choose the RACGP versus ACRM, which is the Australian College of Rural and Remote Medicine, for your rural generalist training?
Yeah. So the fundamental thing is that RG is training specialty within general practice. So both colleges offer the same endpoint. So whether you go with ACRM or RACGP, is really you will end up with the same endpoint and you work with the same. There are differences in how the curriculum is delivered by the two colleges. There are minor, in my opinion, fairly minor differences. We have an emphasis in the FRACGP. We have an emphasis in delivering training that allows you to deliver quality general practice to everyone and everywhere, regardless. In Australia, the assessments are also going to be a bit different. So our assessment processes are a bit different with the RACGP. We are a big organization, so we obviously have more boots on the ground. So getting a mentor and getting supervision would be a bit easier. But at the end of the day, we're training to the same endpoint. We're working together. The two colleges are working together to ensure the RG is recognized by the medical board. So we are working together. So we're really not fast who you take. We just want you in general practice. We want you looking after our people. We want you in the community.
Excellent, thank you. And I saw that you also answered that that even the end goal is the same for both colleges, and both colleges support each other in terms of that end goal and what it looks like. But each college has a slightly different curriculum and different assessment processes. So in looking at those things, you might be able to determine which suits your personality better in terms of how assessments and placements and stuff are done. But
absolutely,
that might be a closer conversation with assessments and the application pathways of both of the colleges. And we will Obviously, there's some contact details and stuff available from this webinar for the people involved here. It might be worth chatting to different trainees of either the RACGP pathway, such as Simone and Siobhan, or some ACRM pathway trainees as well, in terms of gauging their personal experience for what might suit you better as a potential trainee of each pathway as well. In the Territory, through Northern Territory General Practice Education, and right across the nation with all the training organisations, both ACRM and RACGP trainees train together under the same training organisation. So you're often training alongside each other during your journey towards fellowship for either college. We haven't gone into too much detail about how NTGPE supports training in the Northern Territory. We did run a webinar last year with NTGPE and RACGP and ACRM. So if you go to our website, which I'll bring up the details for in a little while, you'll be able to access the webinar that we recorded last year with NTGP as well. And that's got some key contact information on there as well. Good. Another question I had, which I might start with you, Ken, if that's all right. We've talked about rural generalist training and the advanced rural special skills. I'm just wondering what advice you would give to current trainees, junior doctors, or medical students at their stages in terms of thinking about what sorts of advanced specialty rural skills they might be interested in.
Thanks, Olivia. As I said before, when you're thinking about the advanced skill that you want to acquire, I like thinking of it in terms of what's going to be most useful for my community. So it's actually nice to think about the community you're thinking about working in and what's going to be most useful. So if you do anesthetics and go to a community that does not have a theatre, that's not going to be very useful. Equally important is what do you enjoy, what's your passion in, and if you can get those two Venn diagrams and get the intersection, that really is where is what you should be aiming for. And I always think that ideally, it would be nice to actually get a bit of your general practice training, get your hospital term, get your general practice training, your basic general practice training, and just to get you a better understanding of your context before you acquire your advanced skill, because that context is really important in determining first of all, what skill do you want, and two, at what level do you really need to access it? Because we're all adult learners. We want to be driven by targets. We want to be driven by our needs, our learning needs. So it's really quite important to have an understanding of where you are. And then with the RACGP, we offer great flexibility in what the advanced skill, how the advanced skill should be learned and how it will be assessed and so on. So come back to us and say, this is what I want to do with your medical educator or your training advisor, and we will then work out a curriculum that actually fits best for your circumstances. So again, what community and you, where do you intersect?
Thank you, Ken. That's really helpful information. And certainly from an NT perspective, there's lots and lots of opportunities for advanced skills training that'll meet needs of communities. And whether they're procedural or non-procedural skills. Although in terms of procedural skills that might be hospital-based, we do have very limited capacity outside of Darwin and Alice Springs for rural generalist procedural skills that are reliant on hospital-based continuing work as well. So there are opportunities in anesthetics and obstetrics and surgery and stuff, but outside of those areas, we really only have less than a handful of hospitals that can accommodate procedural skills or hospital-based advanced skills training. The greater need for the Northern Territory communities is in Aboriginal and Torres Strait Islander health, palliative care, alcohol and other drugs, public health opportunities, palliative care. And I noticed Siobhan mentioned that she was quite interested in maybe some additional skills training in palliative care and public health. I wondered whether you could tell us a little bit about your motivation for those areas, if you don't mind.
Sure. So I think public health goes right back to when I first decided to do medicine. And one of the reasons I decided to do medicine was a friend of mine was doing, already in postgraduate medicine, was doing an elective overseas in Cape Town, South Africa. And I travelled over there to visit her and looked at what she was doing and what Cape Town University were doing with their medical students, which involved sort of remote setup mobile clinics to rural townships, and also some sexual health screening for HIV and other sexually transmitted infections and comorbidities to be treated around that. So I found all of that stuff really, really interesting. And the two ways that I could see that I could work in those areas were general practice and medicine, or through public health. And I think that public health is an area of medicine where you can make some significant impacts on communities in a more of a far-flung way. You can work in different areas of public health, from working on the ground face-to-face with people and down to policy and things. And I guess with my English background, I really was interested in doing some work in policy. So in my training up here, I've met some other GPs who work a couple of days in clinical GP work, but then they also work for other organisations across Australia, like the Heart Foundation, working with the Heart Foundation Heart Health Guidelines. So there are a number of ways that you can work in a public health capacity that still relates to clinical medicine, but is a really interesting, different approach. From a palliative care perspective, that goes back to one of my own medical student placements. I did a palliative care placement in Sydney, in North Sydney, and I think one of the things that I really love about palliative care is your sole goal is to make someone feel better. And you work with families, you work with friends, you work one-on-one with patients, and your sole goal is to improve someone's quality of life. And while I think that's always one of our goals as doctors, I think specifically with palliative care, you get time to prioritise how someone is feeling, and to, again, I think being creative and innovative in palliative care is so important, in just being able to make things happen and, again, make such a huge difference in someone's experience, which is so important for the individual, but also for their family and their friends. So that's something that I haven't actually done since I became a doctor, only as a medical student, but it's definitely something on my radar that I would like to go into and do some more either specialty training or even just some experience as a GP working in palliative care, because I think it would be really rewarding, and I think the slower pace suits my personality.
Obviously, the opportunities to be creative in everything that you do is really important to you as well. Thank you very much. I'm mindful of time, so I might just share some resources with you. The Flinders Regional Training Hub website, we've got a whole lot of career pathway information and flow diagrams for any potential students, and that includes, I'd like to formally thank Ken Waganu, Siobhan Hensey and Simone Liddy for participating in this webinar this evening. I hope it's inspired some of you out there to embark on a career in general practice, particularly rural general practice anywhere across Australia, but hopefully in the NT, listening to all the wonderful opportunities the variety of medicine, the richness of culture and Aboriginal and Torres Strait Islander health, and working with highly skilled teams in the Northern Territory. So thank you very much, everybody, and thank you to our presenters. It's been wonderful having you all on this evening. So thank you.